So thank you all for being here. It's great to see so many attendees. I think we have a very interesting program today. That's my impression, and I think you'll probably agree with me as the day continues. I'd like to thank some of us, the sponsors who've made this this conference possible, including a number of our industry sponsors whose exhibits you'll see in the next room. So visit them and thank them for being part of this conference today during our coffee breaks, if you will. Also, I'd like to recognize some of the volunteers who've really put in a lot of time and effort to make this conference possible, including Elizabeth Northrup, Pam Sly, Denise Parkinson, Chelsea Parkins, and also Danielle Gautry. And of course, I also want to thank the Binaytara Foundation and our own Dr. Shah, who's really been obviously instrumental in putting this program together today. And just to tell you a little bit about the Binaytara Foundation and their work, I'd like to just call Dr. Damiano Rondelli to the podium just to speak a little bit about the Binaytara Foundation and what that is and what they do and who they are. So, Dr. Rondelli.
Thank you. Can we have the slides on? No slides? Well, while we set up the slides, good morning. It's really, you know, I could spend actually the whole day talking about the Binaytara Foundation. I'm sure you would be excited, but I will not. But it's really something that has made a big difference for many people. And Binay has been inspiring a lot of people, a lot of us. And the reason why I'm here talking about this is because I joined the Binay efforts to help improving the medical knowledge and clinical practice in Nepal, where he is from, a few years ago. And we went the first time on our first trip in 2011, and we went there and we looked at many places. We had a lot of ideas, and then we came back and actually basically none of them really worked. So we kept working on that, and there have been several. Oh, it's there. I was waiting for the slide here. Sorry. So the Binaytara Foundation was actually started by Binay Shah and his wife Tara a few years ago, and it's as a mission, which is pretty straightforward, and I really, which is promoting health and education and changing lives, which is a very easy thing to say, but it really applies to very defined projects and areas in Nepal in particular, but with no limits and no boundaries to also expand to other countries. And the opportunity is for us, and some of you actually have worked with Binaytara Foundation, are volunteers, and I'm really grateful, is to go into these areas and see what they need, not just to bring them what we know, is just to help them to understand what they need and help them growing in their activities. The goal of the Binaytara Foundation has translated into multiple activities. One is actually to promote education and research in these countries, Nepal and India in particular. So the foundation has started a few years ago telemedicine courses where many of us actually were giving live lectures to students or medical residents or nurses or fellows in Nepal and India live. So like we're giving a lecture at 9 p.m. Chicago time, and they were like at 7 a.m. Interesting, the difference time between here and there is like from Chicago is 10 hours and 45 minutes. So it's not even the hours, Interesting thing. Anyway, so we have been doing that, but also we started in Nepal some lectures, conferences. We went there the first time in 2011. Last year, we organized the first conference in the country on hematologic cancers. That's never been done there. As you probably know, there is no fellowship program. There are no specialization in almost any discipline. They're starting now in many things, but not in hematology or oncology. It's very new things. So we went there, we gave lectures, we engaged with the physicians. And this year, like a month ago, we were back again there, and Binay and I, when they organized a conference that Binaytara Foundation sponsored on oncology, and it was very exciting to see these doctors discussing their results, their trials, their goals, and also the challenges of doing practice in oncology in these areas. But our most exciting project actually has been, and that's why I'm involved also, because it's to develop the first bone marrow transplant program of the country. As you probably know, bone marrow transplant is something that here we take for granted. It's the only cure for many patients. Both autologous or allogeneic transplants are utilized in specific for specific indications. Patients in Nepal do not have these options. So what happens actually that the very small amount of patients who can afford go to India or somewhere else to get the transplant, but probably 80 or 90% of the people who cannot afford don't get it, and so they die or they have no opportunity. So the challenge for us was to identify in hospitals and people there who were interested and motivated, and help them do it their own program. So we found these hospitals, civil service hospitals, the government hospitals in Kathmandu, where we have been working with, and I've been very engaged with the physicians. You see the three people in the bottom of the slides are a physician, the one in the middle, actually Bishesh Pudyal, and then the nurse and the pathologist. We hosted them for 3 months in Chicago. We helped them I'm working with them on all their guidelines and SOPs, and the bottom line, we're actually about to start, and that's going to be a very exciting thing. It's a non-profit, it's a government hospital, so it's not to make money, it's to serve people. So it will be affordable to most of the people. So the projects of the Binaytara Foundation that we want to support, and that are actually our agenda for the next year and probably more than a year for the next future, is to develop this transplant program in Kathmandu, to continue. The Binaytara Foundation has sponsored a cervical cancer screening in different districts of Kathmandu. There were over 600 women that were screened thanks to the support, the funding, also of the Binaytara Foundation. And then there's a new project actually that Dr. Shah is in his heart, also besides being in his mind, which is a new cancer center, a cancer clinic in Janakpur, which is his hometown. And it's an area of Nepal that really has no cancer practice. And there are a lot of people there, so he's actually has been working on this project for now sometimes, and we will start. We'll start doing this in the next year. So what we need to do is to supply, to help people. How do the foundation help them? We will provide them the resources to have a physician going there, to have an office where they can practice, to have the supplies and devices that can be the basic oncology practice. So this is a major project for the foundation, but it will make a really big impact on these patients. And the other thing actually to also help these centers to getting closer to our standards, and so that means also to help them with research, to analyze their data, to provide them the tools to understand what they're doing by doing studies on, for example, I mentioned there are aplastic anemia and leukemia, because they have so many cases that is unbelievable. I mean, aplastic anemia is a rare disease for us. In Kathmandu, they've seen 60 aplastic anemia patients in the first 6 months of the year, which is crazy. And there are probably reasons for that. So those are missions that we want to have and accomplish with them. But this is reading outside the hospital actually in Bharatpur in Nepal, and it says, "Do not fear, cancer is curable." That's probably, unfortunately, is what does not happen. Cancer in these areas is very rarely diagnosed at early stages. So most of the women with breast cancer or with a man with lung cancer, at the time of diagnosis, they're already like stage 4. And that's a goal for us to grow the culture and education of oncology to help them achieve this mission. So I think the cards that you find on your tables are a reminder that we are willing to get as many people as possible to work with us and to work in terms of being engaged and promote what we do and raise money to support these activities. Actually, Dr. Shah, is very shy. He's not very good. He's not very good at asking for money. Let me tell you. But this actually is true. We really don't mind changing lives around the world, and that's what we try to do. And it's not our primary job, but it's what, I live in Chicago, I do bone marrow transplant, I do other things. But this really excites me more than my daily job in Chicago. So just to remind you that the website, the binaytarafoundation.org website, you find all this information, all the possible tools. Please spread the voice and help us doing this. Thank you.
Thank you very much, Dr. Damiani. Very interesting and really valuable work that's going on.